This meeting is being recorded.
Hi, everyone. We're going to get started in approximately 2 minutes. Thank you for joining. Okay, I think we're going to get started because we are about 5 minutes past 2:30. Good afternoon, everyone. Welcome to our monthly Emerging Practice webinar series. My name is Jessica Gorham, and I'm the Regional Emergency GBV Advisor, working on behalf of the Gender-Based Violence Area of Responsibility, which is the global coordination mechanism for GBV in emergencies. But for the purpose of today, I am also the co-chair, along with CARE International, of the Regional GBV Working Group for East and Southern Africa. The Regional GBV Working Group for East and Southern Africa, we have a learning series, which we call our Emerging Practice. We like to highlight just about every month a new resource or remind ourselves of a good resource that's available or promote good practice in the field, which is what we're hoping to do today. Just a few ground rules. If we could make sure that our microphones are on mute, that would be appreciated. And also, if you could keep your videos off throughout the hour, because we have people calling in from lots of different places that have varying degrees of internet Wi-Fi connection. So we want to make sure that those individuals have as best possible scenario to be able to listen and stay with us today. So if you could please turn off your videos. So stop your videos, that would be appreciated, because we want to lighten the load for some of our colleagues who are in places that don't have a strong Wi-Fi connection. If you have questions throughout the presentation, please feel free to write your questions in the chat. My colleague, Christine Appio, is monitoring the chat. If you want to just say hello, Christine.
Hello, everyone. Good afternoon.
Christine, who works with us here at the GBV AOR in East and Southern Africa, will be monitoring the chat throughout the hour. If you have questions, she can write those questions down, and then she will present them during the Q&A at the end of the hour. This enables us to group like questions together and then to see what the priority questions might be based on the frequency. I'm also really pleased to be supported today by my colleague also, Ruth Mathea, who is also part of the GBV AOR team here in East and Southern Africa. We'd like to thank Ruth, who is providing technical support today, which is also very appreciated. So I think because, as many of you know, we like to keep our engagements to 1 hour. So I think we'll get started so that everybody, we will end on time, approximately 3:30, maybe 3:35. I might take those extra 5 minutes just because we might have extra questions. So as I mentioned, mute your microphones. Please do put your videos off and write any questions in the chat. And we will be uploading this recording, which includes the presentation, to our YouTube channel. So you can go on to YouTube and search for the GBViE AOR channel, and please do subscribe. This recording and all previous emerging practice sessions are uploaded to our YouTube channel, and you can find those there. So thank you very much for joining us this afternoon, and we're going to get started. So today we're going to talk about promoting the delivery of standardized GBV services across East and Southern Africa. Now, I put East and Southern Africa, but we also know that these standards, these 16 interagency minimum standards, are really universal. Regardless of your context, whether you're working in a development context, a humanitarian context, whether you're considered a context that's on the nexus, these standards are applicable. And that's what's really great about them as well. So I'm just going to give an overview of these standards. And if you would like to have additional information, you can find these as well as facilitation guides, PowerPoint presentations, a poster size of the 16 minimum standards on our GBViE AOR website. And maybe one of my colleagues can put that directly in the chat for you so that you can find all of the additional resources there. You might notice on this first slide that we have the minimum standards in many different languages. So I am presenting in English today, but I see we have Suleiman, for instance, in Mali. We do have the minimum standards in French, Portuguese, and English for East and Southern Africa, but we also have them translated in a host of other languages, such as Korean, Arabic, Spanish, Swahili. So please do go on our website, and you can find these in a lot of other different languages as well. I think Russian is in there. So really, we think these standards are so important that we had them translated into a host of different languages. So I want us to listen to a little video, which kind of gives us a summary of the international interagency standards. And then we're going to go into them for some depth, and then we'll have some questions. Next slide, please.
You work with women and girls in emergencies and are committed to addressing gender-based violence. Often, you are the first to respond. But you also have questions on how to safely and effectively deliver services. How can I increase women's participation? What is a quality safe space? When is a referral complete? What skills should GBV staff have? How can I better assess GBV risk? Did you know that there is a resource where you can find the answers to all these questions and more? The Interagency Minimum Standards offer clear and practical steps any organization can use to help address gender-based violence in emergencies using a survivor-centered approach. Multi-sectoral response to GBV is life-saving. With the 16 minimum standards, we know what to do to improve the health, safety and well-being of women and girls in emergencies. Visit the website to find out more, and please like and share this video.
Great. So this provided us with a summary, but let's go on to the next slide, please. So, as I mentioned, The minimum standards are broken down into 16 individual standards, or what we've considered the individual standards. And those are further then broken down into what we feel, or we're categorizing as foundational standards, program standards, and we'll see the last three as well. Let's start with the first three, these foundational standards. So these foundational standards, which are basically the GBV guiding principles, women and girls participation and empowerment, and then staff care and support. So we consider these foundational, which means that regardless of the intervention that you are implementing, it could be a legal aid intervention, it could be a health-based intervention, it could be a psychosocial support intervention, we think these standards should be at the foundation of all that you do. So the three foundational standards are critical individually and also fundamental to the implementation of all the minimum standards. They must underpin all program elements and actions. So as I mentioned, those first three, and these are non-negotiable. Whether you are a health agency implementing clinical care, you must incorporate these standards. You might not be as invested in, for instance, economic empowerment and livelihoods from a health perspective, but these standards must be incorporated into your project or your interventions. And those are, again, I'm going to repeat them because these are really important. The GBV guiding principles. Can anybody write in the chat what those guiding principles are? Anybody? Can you write in the chat? Yep, Rachel said confidentiality, really good. How about some of the others? Safety, excellent. Hiba, respect, awesome. Yep, confidentiality. Dignity, Rabia, good, excellent. Privacy, how about if we also do safety? And I like, Lino, you're saying non-discrimination, excellent. So for us from a GBV perspective, we consider those four sort of our guiding principles, our non-negotiables, that we treat every survivor or person at risk in a non-discriminatory way. We respect their rights. We also make sure that they are protected and that their safety is upheld, respect, and we cannot undermine or we can't emphasize enough confidentiality, which is often one of the main reasons that we don't have survivors accessing services because of a lack of confidentiality. We are also, as I mentioned, women and girls participation and empowerment. So regardless of what kind of programming, we need to make sure that women and girls are engaged as active partners and leaders in influencing the humanitarian sector to prevent GBV and support survivors' access to quality services. And then, as I mentioned, the next one would be staff care. And this is one we often overlook, but we believe here at the GBV area of responsibility, and then also, of course, all of our partners who developed these guidelines, that staff care should be at the forefront of all of the work that we do. And that's basically GBV program staff are recruited and trained to meet core competencies, and their safety and well-being are promoted. So those are our first three, and we consider those foundational, as I mentioned. Next slide, please. Next, we have 10 standards out of the 16, which we consider our program standards. And so our program standards are the 10 program standards that provide guidance to respond to, mitigate, and prevent GBV in emergencies. They reflect the core GBV programming elements. We recognize that this list of sort of program standards is not exhaustive because we've listed 10. And many of you who are joining us today might actually be implementing programs that are beyond the scope of these 10. And that doesn't mean that your programs are not important. It just means for the purpose of these guidelines, we focus sort of on the 10 most critical. And so those 10 guidelines or programmatic standards relate to the collection and use of GBV survivor data. So that we're making sure basically that survivor data is managed with a survivor's full informed consent for the purpose of improving service delivery, and also that it's stored and analyzed and shared ethically. The next program standard would relate to healthcare for GBV survivors. We want to make sure that survivors have quality, survivor-centered healthcare, including health services for sexual and intimate partner violence and other forms of GBV, to prevent and or reduce the effects of violence. Our sixth standard, which is one of our programmatic standards, is psychosocial support. And this is so that we can focus on healing, empowerment, and recovery. So the guidelines, we give you sort of the basic minimums that we think you should include in your psychosocial support programming in these guidelines. We provide you with key actions on what is needed to adequately meet the needs for psychosocial support programming in an emergency. The next programmatic standard we have is GBV case management. And many of us know this could have a 4 to 5 day training, just focusing on the standards that we aspire to achieve in case management and emergencies. The 8th minimum standard relates to referral systems. We consider this a programmatic standard because we know that referral systems are in place to connect a GBV survivor to appropriate quality multi-sectoral services in a timely, safe, and confidential manner. This next one. Our 9th standard relates to women and girls' safe spaces. So we as a community have recognized that women and girls' safe spaces are really the cornerstone for many interventions that are happening across the region. So women and girls' safe spaces are really proliferating, right, in many of the contexts in which we work. And so I really wonder if there's a women and girls safe space in Somalia, does it look the same as a women and girls safe space in Ethiopia or in South Sudan or in Chad or in Bangladesh? It should. If we're actually having standards in place, then women and girls safe spaces should have the same level of service provision in every context. They should be standardized. Certainly, we should go above the standard, but we shouldn't go below the minimum requirements. And these guidelines provide that. Does that make sense to everybody? So our 10th programmatic is safety and risk mitigation. So ensuring that GBV actors advocate for and support the integration of GBV risk mitigation and survivor support across the humanitarian sectors. And we want to make sure that these risk mitigation measures are promoting our guiding principles and also the safety and security of survivors and those at risk. And so this guidelines provides minimum actions or key actions on how we can do that in order to meet basic standards. Next, we touch on justice and legal aid, making sure that services protect the rights of survivors and promote their access to justice. We also look at dignity kits, cash and voucher assistance, also really important. Are the dignity kits that we are distributing in Palestine of equal quality to the dignity kits that we are distributing in North Kivu in the Democratic Republic of Congo? Are we taking into account the guiding principles and also ensuring that women have participated in the process of how we determine what we will actually deliver? Does that make sense to everybody? I hope so. That's what we mean by minimum standards. And then lastly, we look at GBV economic empowerment and livelihoods. And so this is also, I think, a unique sort of program standard because economic empowerment and livelihoods encompasses a lot, doesn't it? And so we want to make sure that our programming doesn't inadvertently cause more harm, particularly when we're talking about these economic empowerment and livelihoods, and that we're promoting resiliency and recovery as part of our program standards. Next slide, please. And then lastly, our last three standards relate to process. And so the three process standards provide guidance on critical processes for implementing elements of GBV programming. So these we kind of see throughout the program cycle. One of those, of course, one that's very dear to my heart because I work 100% on strengthening GBV coordination. And we want to make sure that we're not meeting just to meet, but that our coordination actually results in timely, concrete action to mitigate risks and prevent and respond to gender-based violence. And these guidelines provide basic steps on how we can do that. So regardless of whether you are implementing a GBV case management intervention or a livelihoods project, or if you are looking at distributing dignity kits, it should all be done within the framework of GBV coordination. So whether you might have a GBV AOR in your country, or you might have what we call a GBV subcluster in your country, or you might have a GBV working group in your country. And the idea is to make sure that during your implementation, that you are in fact coordinating amongst other partners so that it cuts down on redundancy and make sure that standards are being upheld. Okay, if you have any questions, please do put those in the chat. My colleague Christine is monitoring the chat. and she will be able to put those questions together or answer them as we go if needed. Okay, so what is our next one? The next one, or the 15th minimum standard, is related to assessments, monitoring, and evaluation. And we strongly believe that before we do any sort of intervention, we need to assess the needs for that intervention. And then we also need, throughout the implementation of it, monitor and evaluate the safety and ethical considerations, but also whether we're actively being effective. And then lastly, and we often, I think many of us, if we really think about our own projects and programs, how many of us do have built in monitoring and evaluation on a regular basis, not just as a part of the end result or the end assessment? That throughout you are monitoring and evaluating the safety and the quality of your projects and programs. And so we've very much included that as one of our minimum standards, because we do believe that you have an ethical obligation to make sure that you're monitoring regularly the implementation of your programming to ensure the safety and security of your survivors, and so you're not doing more harm. And then lastly, our 16th standard relates to transforming systems and social norms. And in emergencies, we often don't get to this sort of transforming systems and social norms. But we can always make sure that even in emergencies, our programs are not inadvertently going against feminist principles and approaches. We can adapt feminist principles and approaches in all of these standards, regardless of what kind of service you are providing and at what or in what area of the intervention. Does that make sense to everybody? Okay, so as I mentioned, these are our 16 minimum standards. But that doesn't mean that we can't look beyond the minimum. Next slide, please. Where does this fit in with all of the other resources that have been developed by the GBViE AOR and that we promote on a pretty regular basis? So many of you, I hope, have seen the guidelines for integrating GBViE interventions in humanitarian actions. That resource is really about mainstreaming or integrating GBViE risk mitigation measures throughout all sectors. And that one is really for all humanitarian actors to incorporate GBViE prevention and mitigation into specific sector interventions. We also very much highlight the handbook for coordinating gender-based violence interventions in emergencies. And so this handbook is kind of our Bible, really. And so this handbook helps us support the minimum standard on coordination, but it really includes lots of different resources that are helpful to anybody who's implementing programming, regardless of the context. So of course, this handbook is for coordination, and it's designed primarily for GBViE coordinators and those who are members of subsectors or subclusters. Which brings us to the difference. The reason I put this slide is many people were confused as to how all of these resources connect, but also how they are separate. And that, as I said, brings us to this one, which is our interagency minimum standards for GBV programming in emergencies. And this one is specifically for GBV prevention and response programming. This resource is very specific for GBV specialized actors and partners. If you are a member of an organization who is implementing a GBV project or program, it's really important that you are aware of these minimum standards. The minimum standards, as I mentioned, in our multiple languages, this is how much we think these are important. They're in multiple languages, and they were developed through a very interagency consultative process. We had a task team at global level that included a lot of the agencies that are joining us today. So these big agencies that deliver GBV services across contexts across the world all came together to develop these guidelines. So, okay. So, next slide. What can you find in these as a resource? Because I see lots of you asking questions about what actually does this mean? I have incorporated the icons to the left here. These are exactly how they look in the guidance. You will see we have key actions. The really great part about these key actions for each one of the minimum standards is that we start from a preparedness phase. So these are key actions that you can think about and incorporate into your programming at every stage of an emergency, from preparedness to recovery. So whether you're looking at health services for survivors, what do we need to do in the preparedness? And then also, what can we do in the recovery phase? And you'll find that in these key action sheets. Next, we also have indicators. And we really encourage you to look at the indicators for each of the programmatic standards so that you incorporate them into your project proposals and then also incorporate them into your monitoring and evaluation. These indicators promote good standard practice. And if you incorporate them into your project proposals and into your reporting and your monitoring and evaluation, then you'll uphold at least the minimum. But as I said, the ideal is for it to uphold even beyond minimum, right? To surpass. That would be the ideal. We've also included in this guidance notes or links to guidance notes. I saw someone in the chat had asked about how do we address men and boys in our programming. And so you will see guidance specifically or links to guidance that are specific to exactly that. Or you might ask, how do we incorporate sexual exploitation and abuse in our referral systems? And there are links to guidance on how you can do just that. And then lastly, there are tools and resources, other links. For instance, or example, we talked about women and girls safe spaces. We have a toolkit that was developed by IMC, a toolkit that specifically looks at the standards that should be adhered to when you are setting up and operationalizing women and girls safe spaces. A lot of thought and effort went into creating the toolkit for women and girls safe spaces. And so the minimum standards are outlined in this guidance. But then really for each of those, we have other complementary guidance or toolkits that can help you operationalize it in your context. As I mentioned, the Women and Girls Safe Space toolkit or guidance is available on the GBViE AOR website, and you can also just do a quick Google search and you'll find it. My guess is that many of you who have joined us today are implementing things like Women and Girls Safe Spaces. And I really encourage you to look online to be able to look at the guidance for not only Women and Girls Safe Spaces, for all of the programmatic standards. Next slide, please. So very quickly, the standard, what GBV actors must achieve to prevent GBV and deliver multi-sectoral services to survivors in humanitarian action. As I mentioned, it includes the key actions. The key actions should be seen as a menu of options to take to achieve the standard, and also as a means to contextualize implementation. And the key actions are not an exhaustive list, nor a prescriptive of how to. Indicators are available. Indicators to measure achievement of the standard, not the individual key actions. Guidance notes. The guidance notes at the end of each section provide further information and advice relating to each standard. As I mentioned, specific populations, practical suggestions to overcome challenges, tools, existing tools such as templates and standard forms, and then, as I mentioned, the resources. All of those are contained in the interagency minimum standards for GBV programming. Next slide, please. Why do we have these? We have these standards to enhance accountability and establish clarity on what constitutes a minimum GBV response. So that if you are working in the Central African Republic, survivors and those at risk can hope to have the same level of a response as someone who is living or even working in a place like Syria. And this also helps to inform donors as well. And these guidelines were developed in partnership with some of the key donors who many of you receive funding for. So you can use these guidelines as a justification as to why you need funding for certain actions. And then who are they for? They're for GBV prevention and response actors and partners, including local women's movements, women-led societies, civil society donors, etc. Next slide, please. And lastly, and I think someone in the comments, before we go to our questions, what do we mean by minimum standards? So the standards taken together outline a common agreement on what needs to be achieved in order for GBV prevention and response to be of adequate quality. Again, these are minimum standards. This doesn't mean we can't surpass the standards. That would be the ideal. Each standard represents a common agreement on what needs to be achieved for that particular programmatic element to be of adequate quality. What do you need to have in place in order for you to deliver clinical care to a GBV survivor? We need to make sure that there's a separate room to do the exams. We need to make sure that service providers, medical care survivors are trained to deliver clinical management of rape. We need to make sure that there are the right equipment and the drugs available. These are all part of what we need in order to have adequate care for survivors under the health standard. So adequate quality basically equals do no harm, and it reflects just generally good practice. Each GBV actor is not required to fulfill every standard, but you can certainly do so. If a GBV actor takes on a programmatic component of the minimal standards, that actor must achieve according to the standard. If you are unable to meet the standard, then perhaps you should not be implementing that programmatic element. And then lastly, that GBV response of adequate quality will include all 16 minimum standards across the response. So that doesn't mean that your organization has to provide it. It just means that in a context like South Sudan, for instance, that each of these program areas or these minimum standards should be addressed by at least one organization to ensure full coverage and that we're meeting, again, those standards. Okay, I think that's my last slide. Let me just double check. Yes, good. I'm conscious of time. We have about 15 minutes for questions. As I mentioned, this is really an introduction to our minimum standards. This is also noting that if you go on to our website, which we put the link in, our minimum standards, you can also find lots of other resources available that promote the implementation of these standards. But we wanted to make sure you knew that these exist and that they should be incorporated. So I'm going to turn it over to Christine, who I think has been collating the questions throughout the presentation. Christine, over to you.
Thank you, Jessica. The interesting questions and comments. Can everyone hear me?
We can hear you well.
Okay, so there are questions, but also a number of interesting comments. There's a question from Lawrence Lewis, which is around whether UNFPA collect, analyze, and report data, such as for the gender aggregated reference indicator. Not sure what that is. But it's specific around that, you know, the number of people or GBV survivors who receive support. You know, if such data is collected and how wide is it shared? Perhaps you could talk more around how the minimum standards that links to data collection and information sharing.
Really good. Thanks, Christine. Yeah, I can't go into it in too much depth because of time, but I can say at the GBV AOR and our member organizations, we do not encourage reporting or basing our program success on the number of survivors identified or incident data. So we would not promote that. What we do promote from an information management perspective is that we look at program delivery. So instead of the number of women raped, we would look at the number of health centers that have adequate and quality CMR or general health services for survivors. That's more important, and that can actually tell us more than the number of incidences. We know that GBV exists. And so it doesn't do us any favors by counting or presenting incident data, especially in many of our contexts where we don't have full coverage. We also know that we often use this phrase, it's just the tip of the iceberg. And we cannot ensure, in most cases, the safety and security of those survivors. So what we do instead is really focus on the quality and the level of service delivery in terms of information management. Next question, Christine.
Thank you, Jessica, for that. There's a question from Emenet as to whether an agency can fulfill all the minimum standards through referrals. Can an agency fulfill all the 16 minimum standards, even when they are not implementing those specific standards through referrals?
Yeah. Good question. So no. I think that if you are a part of a coordination mechanism, such as a working group or the GBViE AOR at country level or a subcluster, then it is your responsibility to make sure that all, or a collective responsibility, I should say. It's the collective responsibility of member organizations to ensure that all services on the referral pathway meet these minimum standards. But in practice, it would not be your onus or your responsibility to operationalize it within another organization. So no. So the collective responsibility of every organization to make sure that services in the referral pathway do meet these standards, but it's up to the individual agency to reach out if they need additional support, but then to make sure that their programs and policies reflect these minimum standards.
Thank you, Jessica. There's a question from Lily, which I think very much linked to the one you just responded. Lily is wondering that with the current funding constraint, how can the GBViE AOR ensure that all these standards are achieved through different partners?
Yeah, really good. I think what we're kind of promoting is that if you can't meet these basic minimums, then you need to really think about whether you should even be delivering this service. Otherwise, you could be causing more harm. Does that make sense to everybody? If you can't at least meet the minimum, then ethically, should you be delivering that service? And we're not talking about providing air conditioning in a health center. What we're talking about is making sure that there's equipment available to treat a survivor. We're not talking about setting up a fancy office so that you can do one-on-one counseling or mental health interventions with a survivor. What we are saying is that if you're going to introduce or do mental health services, then you need to have a specialized service provider who can provide that level of care.
Thank you, Jessica. Eleonora's question is whether there is a guidance on a response-wide assessment of the minimum standards implementations in programs.
If there's guidance?
Yes, on a response-wide assessment of the minimum standards implementations in programs from different agencies. Has there been any assessment of the minimum standards implementation?
No, great question. And maybe a great segue, because the GBViE AOR here in East and Southern Africa, we've recently gotten some funding to look at just that, about quality of services. And are those services being delivered within these standards of care? So not yet, to my knowledge, has that been done. But again, I'm very specific to East and Southern Africa. So in other regions, there might have, but not that I know of. And I'll ask Christine if she also knows of any. And then I can also say that we have been monitoring from the regional level in East and Southern Africa on 7 of these minimum standards across countries that have clusters. And if you would like to access how we are doing these standards, you can look at our dashboard, or reach out to our IMO, Adishmato, and maybe we can put his information in the chat, and he can, I think actually we did have a learning or an emerging practice webinar based on this. So the answer to your question is short term, I don't think so, but we're about to embark on that coming up. So great question though, great question.
Then Christobel, and I think this relates to the minimum standards on safe spaces. She's asking if you know, what is the comparative advantage UNICEF has to establish safe spaces, especially in settings where other agencies have also established safe spaces, but not in all districts.
I think you mentioned specifically UNICEF, but I think we can broaden that question to any agency. What is the added advantage? And this is really why it's important for all of you to be members of the coordination mechanisms in your country, to understand who is doing what and where, so that we don't have duplication. And to leverage the specificity or the speciality of each organization. For instance, in some contexts, it's really the role of local women organizations to operationalize women and girls safe spaces. Where in other countries where we have refugees or IDPs, oftentimes it's international organizations. So there's no easy answer to your question. But I will say it's really important that you check in or you join, if you haven't already, I'm going to assume everybody has, your local, your national coordination mechanism to understand where your comparative advantage is in that whole process of women and girls safe spaces. Certainly UNICEF, they have child-friendly spaces as well, and we often like to co-locate some of these. So it really just depends on the current level of services you're providing, the experience, the technical experience that you have within those contexts. I think we have time for one more question, and then we will close.
Absolutely. So there was a question around success story for the 16 minimum standards, which I think you already responded to a question linked to that. Mukhtar is more of asking a follow-up question on data. His concern is that while budgeting, donors tend to ask figurative data to allocate per survivors. So how can this be managed?
Well,
should agencies be sharing data, you know, a number of cases with donors for funding?
Ideally, no. I mean, we shouldn't base it on incident data. So what we can do is we can look at trends. If your country, for instance, in a place like DRC, the Democratic Republic of Congo, they have 122 partner organizations who collect data ethically and safely, part of an information management system that then is anonymized and published through the Ministry of Gender each quarter. And that's the kind of data that you can then take back and incorporate into any kind of proposal, because it's anonymized and it looks at trends. We would not recommend looking at individual organizational incident data. As I mentioned, because you're only getting a snapshot of the problem, and you don't want to undermine your proposal. But also, we need to think more about the safety and security of those survivors. And if it's any of our big donors, they are all well-versed in this policy that we don't promote the use of incident data. So the Americans, for instance, the British, lots of other big donors for GBViE do not require that because they know because of these elements I've just said. I think Christine will end here because I know that we're close to ending our hour, and I think everybody here at the GBViE AOR and the East and Southern Africa, or the Regional GBV Working Group for East and Southern Africa knows we like to keep time. I want to thank everybody on behalf of CARE International and the GBV AOR, who are the co-chairs of the Regional GBV Working Group. We would like to thank you very much for joining us for this month's edition of our Emerge in Practice series. Please do join us next month. We will be presenting a paper that was just published by our help desk on how to integrate or how do we deliver programming in conflict zones or hard to reach areas. And I think many of us right now are experiencing that so much. So please do join us next month for our next emerging practice, where we will be delivering our just recently republished report from our help desk on how we implement services in conflict zones and politically maybe volatile areas. So thanks everybody for joining us. As I mentioned, we will be sending you the recording of this, but you can also find it on our YouTube channel. Please do go on our YouTube channel and you can find the recording, and which includes this presentation on our YouTube channel at gbvaor.net, and also any previous learning events that we have hosted. So thanks everybody for joining. It was good to see you all on the line. Please be safe where you are. And thank you for the work that you're doing on behalf of women and girls. Thank you so much and have a good afternoon.
Thank you so much. Thank you so much. Thank you so much. And bye-bye, everyone.
Thank you.
Thank you very much.
Thank you so much.
Thank you.
Thank you
Bye-bye.
so much. It was great.
Thank you so much. Thank you.
So much.
Thank you so much. It was a great presentation. Thank you.
Thank you so much. Thank you.